Welcome to the Love Letters to Our Bodies podcast. I'm your host, Gwendolyn Mitchell, founder and CEO of Moyo Institute and lifelong spiritual seeker and energy worker. Here for thoughtful conversations about health, healing, and happiness by, for, and about Black and African American women. Disclaimer, the Love Letters to Our Bodies podcast does not provide medical advice. The opinions, experiences, and insights shared are for informational purposes only. Nothing shared in this podcast is intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other healthcare provider. Don't disregard or delay seeking it because of what you've heard on this podcast. Thank you. Are you ready? Let's dive in. Good afternoon. I'm Gwen Mitchell, host of Love Letters to Our Bodies podcast. I'm happy to be joined today by Michelle Moseley and Marion Harris, both of the University of California, San Francisco, UCSF. First, let me tell you a little bit about Michelle. Michelle Moseley is the program manager for health education and community outreach at the Helen Diller Family Comprehensive Cancer Center at the University of California, San Francisco. She's trained in public health, health education, cancer control, and community engagement. Her evidence-based work fosters multi-level partnerships, activities, and interventions that contribute to advancing health equity and improving health disparities in historically under-resourced vulnerable populations and communities. Ms. Moseley holds a bachelor's degree in health science, health education, a master's degree in health science, health administration, and she also holds a master's in certified health education specialist credential. So thank you so much, Michelle, for being with us.
Yes, thank you so much for having me. And I'm going to say that if it makes it easier, we can just refer to us as UCSF and we don't have to add all of the additional departments and centers.
Okay, wonderful. Marion Harris is a registered nurse for more than 40 years. Sister Marion earned a BS in nursing, a public health nursing certificate, faith community nursing certificate, and 2 master's degrees, nursing administration and education. For the past decade and a half, Mrs. Harris has focused her professional and ministry life on the development of health and wellness programs in faith communities. She's active in many professional organizations on the national and local level. She has worked for John Muir Health in Concord and St. Rose Hospital in Hayward, developing health ministry programs in local faith communities and building and maintaining partnerships. She also was at UCSF as the outreach director for that same cancer center program, and she's currently a college and university professor. And we'll hear more about Marion's background as we proceed. So Marion, thank you so much for being with us here today.
Thank you, Gwendolyn, for the invitation. It's my pleasure.
Thank you. So let's just start, Michelle, with you. For our listeners who may not know of UCSF's community-facing work, can you paint a picture of what cancer education and community engagement actually looks like when it's done well?
All right. Yes. Once again, thank you for having me on the podcast. And just a little bit about our cancer education and cancer information programs. What it looks like when it's done well. The short answer is better health outcomes for everyone, everywhere. Access to prevention strategies and tools, access to care, patients who survive and thrive. We also are looking to connect with community for outreach and education that is tailored and customized. And when we refer to outreach, we're talking about something that's short term with an intent to inform or get people to act on something, such as get screened or attend an event or something of that nature. And then as it relates to health education, we are looking to have an impact on knowledge, either to increase knowledge or to positively change attitudes, beliefs, or help people develop skills for healthier behaviors. So the health education portion is where we're looking at tailoring and customizing our activities, whether it's smoking cessation, whether it's healthy cooking, whether it's teaching women how to do breast self-exam, or teaching how to use the at-home self-collection colorectal cancer screening kit, stool kits, or human papillomavirus or the HPV cervical cancer screening self-collection kit. So things where we're teaching skills and teaching and increasing knowledge and helping people to apply what they've learned. And then the latest kind of term that we use, what we call community engagement. And that's where we're looking at that bidirectional partnership, communication, as it relates to any programming that we do that's health education related, that's research related. Anything that we're implementing, we're doing it with the community from the onset of planning to implementing it to evaluating or revising it. And the community engagement is where we're looking at activities that are going to create some sort of long term, it's for the long haul, and activities that are going to create some sort of system wide or policy type changes as it relates to achieving health equity or improving cancer outcomes. And one of the tools that we use for our community engagement is our community advisory board. And then there's a number of committees and committee programs and activities that fall under that community advisory board that we've had in existence for over 20 years now. So that's what I mean by for the long haul, but we also engage in activities that might be more short term.
Thank you for clarifying for us, because I think for the layperson, when we think about community outreach and community engagement, we're thinking about one thing, and it's really helpful to understand from an institutional perspective how those two things are different. So thank you for that. Marion, you've been a part of the Faith Communities Committee since 2006. That's nearly 20 years of building this bridge between church and health. What called you into this work, and what has kept you there?
This work is a product of my life. I'm a breast cancer survivor, having had my first diagnosis in my late 20s, having a mastectomy at that time, and 10 years later, having the second mastectomy. So I've had bilateral mastectomies and chemotherapy twice. And through my journey, when I first started out, they said young women don't get breast cancer. And I had to advocate just to get someone to do a biopsy for me. They was like, yeah, well, it's just a lump and you don't get breast cancer. And it took me 3 years to get that supposed lumpectomy, which turned out to be 24 hours later, a modified radical mastectomy followed by chemotherapy. And at that time, I went through various stages. It's like an onion. I've gone through so many stages with this over the last 40 years. So at that time, I thought, being a nurse, the only breast cancer patients I had seen were stage 4, and they were dying. So my immediate thought process when I called my family is, I have metastatic cancer, and I'm going to die, and they're going to do a mastectomy, but, you people need to come. And that didn't happen. But the Cancer Society sent to me an older lady, probably in her 70s, to reassure me that there was indeed life after breast cancer and a mastectomy. And I just wasn't buying what she was saying. I felt that I could not possibly have been the only young woman with this. So I started volunteering with the Reach for a Recovery program. And I could have had a full-time job seeing young women with breast cancer. And it just kind of mushroomed from there. I have a public health nurse certification, and I had an opportunity to develop a program for St. Rose Hospital, which transitioned over to John Muir, working with faith-based communities, helping them establish health ministries where they would reach out to their membership and the surrounding community, offering health information and advocacy and connecting with organizations like UCSF, that could bring credible information into the community on how to be proactive in our healthcare. And it's just been a beautiful relationship. And they kind of just got stuck with me because this
Beautiful.
work is so necessary, in my opinion. And I don't even see it as work. For me, it's a mission and a calling and something that I just have to be involved in.
Beautiful, beautiful. Thank you so much for your service, and thank you for taking what started out as a real challenge, a real health challenge, and letting that inspire you to become a compassionate servant for others. It's just been extraordinary. So thank you for all of the years that you've been involved in this beautiful, beautiful service. So let me go back to you, Michelle. From a public health lens, what do we know about the role that the community belonging, including faith community, plays in health outcomes for Black women with cancer?
Yes. And let me just thank Marion, too. We are going to keep her as long as she wants to continue working with us. We feel like we're joined at the hip, or so to speak. But yes, well, when we think about public health and what we're aiming to do, we're really aiming to improve the quality of life of all people, where we live, where we work, where we learn, where we worship, where we serve, play, have our leisure, all of that. And that includes everything from seatbelt safety, vaccinations, speed limit type of activities, to getting into some of the areas like no smoking, no vaping zones in buildings and things of that nature. It also involves our cancer screening test and other screening tests and healthy foods. So all of those kinds of activities where we're trying to protect the public's health and give people access. And then when I'm thinking about belonging, helping people to know and experience that they are valued, there's a place for them, they're recognized, they're seen, they're heard. I think when you look at belonging and public health, we're actually in both of them striving to be inclusive and bring people together and ensure that they get what they're going to need in order to facilitate access to services and access to care. Now, when I think about our faith communities initiative and the role in public health and in belonging, and just sort of the general role, broadly speaking, about our faith communities is generally having people gather and ascribe to a certain set of practices and values. But some of the things that we've learned more specifically as it relates to the predominantly Black or African American churches is that there are distinct roles and practices that help facilitate the public health tenets, as well as some of the aspects of belonging. And some of those are what we call the caring practices. That's where you're providing comfort and nurturing and support and healing type ministries. There's also sort of the education practices that might involve instruction and classes and teaching and sermons and messages and things of that nature. And then there are the sort of mediating, or what we call the intermediary practices. That's where you're connecting people, serving as that connector or that broker of getting people to connect with community resources and services and social support services. And then there's what's called the sustaining practices. That's the sort of ongoing communication activities that keep people informed about not only what's available in the life of the faith community, but in the life of the community as a whole. So that could be announcements, bulletins up, people who make phone calls, or people who do home visits to check on people. And then there are the sort of advocating practices, the voter education. Let's get people registered. Let's get people educated about policies and issues that can affect not only the faith community, but the community and society as a whole. So all of those caring practices also have a place and connect as it relates to public health. So together, that's a key role in how public health and some of the practices of the faith community are bringing people together and bridging to help people have better health outcomes, particularly as it relates for this talk and this podcast for Black women with cancer, and et cetera.
I really love that you broke those down so specifically because I think for the average person going to church, we just think of it in terms of going there for our community, for the connection, to be kind of spiritually fed, but to have taken a real look at what the various practices are that make up that experience, that overall experience. I've never heard it described quite so comprehensively. And I think our listeners will really appreciate hearing that as well. So, Marion, I want to go back to you. The Black church has always been like centers for healing, not just spiritual healing, but communal, physical, emotional. How do you see this tradition showing up or sometimes getting bypassed when a member is dealing with cancer?
Well, I do believe it shows up. Might not be as overtly as we would like it to be. But, most of our churches have some type of prayer circle. And I listen. We have a lot at my church. Every day there's a prayer online on Zoom or in person. And I'm always listening. And there were people who will be praying, we want heal us now. Heal God can heal and heal us now. And then that prayer might evolve to, we know that it is your time and it is your plan. And we know that healing can be in many ways. And if I don't get a immediate boom healing, maybe I'm going to get a healing in my mind. Maybe I will be able to come in peace with my life, with myself, at peace with my family and my community. And I would have that healing in my mind. And maybe my healing comes from my spiritual growth, that I've been able to recognize my place in this universe and God's place in my life. So it's not this, we sometimes when we're talking healing, we're really saying cure because we want the disease to just go away. But there's not always a cure. But healing can be threefold: mind, body, and spirit. And so that is brought up in our churches, sometimes overtly, but most times it's a silent thread that's running through. And it's not always accepted. I get so excited when I hear my minister bringing a message and all of a sudden it has this healing flow that comes through, and he'll say, we need to get our exams done and we need to see our doctors and we need to do what we can do because if you take a step, the Father will take a step towards you. But you have to do your part. So when we're talking about our health and healing, doing my part, staying up on top of my examinations, and then taking my medications as they're prescribed, eating the foods that I'm told to do. So that's not an overt message from the clergy, but it's a message that's actually supporting what we're saying in our wholeness and healing journey. We have a role to play. Yes, there are all of these societal factors, but we're not, what is that? We are not of this world, but we are in this world. So there are things that we can do to better ourselves, to put barriers up to the negativity that is presented. I love the smoking that Michelle talked about. That's one of my things right about now, smoking and vaping. Anyway, that anti-smoking and vaping campaign. Yes, our churches can be smoke-free environments just like government buildings can be. We're going to say, well, we can't do that because we want people to come as they are. We most certainly do want people to come as they are, but they can not vape or smoke for the hour and a half that they're on their church campus.
Or at my mama's house when I was
Oh,
growing
well,
up. No smoking in loud in my mama's
girl, we
house.
had a sign on the door. I was so humiliated. My grandmother was so far ahead of her time. There was a sign on our door that said no smoking because she said it made her cough.
Right.
And we were like the scourge, their grandmother's crazy. Well, she wasn't that crazy. She was
I think
before
we
her
had that
time.
sign too,
Yeah,
actually.
yeah. So all of these things. And so I kind of draw back from saying that in church we don't acknowledge illness and dying, but every church is their own community. They have their own culture. and they have their own way of responding to things. So just because the response at Michelle's church isn't the response that's at my church doesn't mean that her church isn't responding appropriately. I'm on the
Exactly.
outside looking in. It's just like being in a family. You never know all the
Exactly.
drama. There are three sides to
To
every
every
story.
story.
And that's how I look at it.
Hmm.
My way is not the only way.
That's beautiful. That's beautiful. One of the first things we do in the Love Letters to Our Bodies workshops is talk about the difference between curing and healing. And to let people know that, for instance, curing is the elimination of the symptoms. And it's really what the traditional or the more allopathic medicine is focused on. And that healing is about getting to the root cause, the underneath, and those kind of intangibles, the emotional part, the burden of stress, all of those kinds of things. And that I like to tell people that when both curing and healing occur, I refer to those as miracles, you know, when both the physical challenge is addressed and removed and the person sees what has come out of the experience in terms of their spiritual growth or their perspective and their understanding about their place. I love what you said, their place in the universe, that is indeed healing at its best.
I think, if I'm allowed, one of my most powerful experiences was about 15 years ago, maybe 18 now. A young woman in her 30s was pregnant, and they discovered that she had cancer, and they wanted her to abort her child. And she said, "No, I'm going to have my child." And she did. But the cancer continued to spread, and she did eventually succumb to it. But in that entire journey with her, her witness was always, God can remove this. He can heal me. But if he doesn't, I'm still his child. I'm still in his will. I'm still in his way. And my daughter is here. I trust him that this journey, however it ends up, is his will for my life. And that was just such a strong, she never wavered, even in the last hours of her life. She said, even now, he could raise me up. But if he doesn't raise up my physical body, my soul is intact and I know where I'm going and what my plan is.
Wow, that is very, very powerful.
God is, it's just awesome. It sticks with me always. I think of her quite a bit. And her daughter is in college now.
Beautiful,
Mhm.
beautiful. Thank you, thank you. Michelle, Black women are disproportionately impacted by certain cancers and significantly underserved by the healthcare system. What do you want people, especially Black women, to understand about why that is and what can be done?
Yes, as you mentioned, Black people have the highest death rate for many cancers, breast, prostate, lung, colorectal, which are some of the most common cancers. And each of them have screening tests for possible early detection, early diagnosis. Unfortunately, we have a broken healthcare system and a democracy that's based on racism, bias, oppression, power and control, the haves and have nots, and just persistent issues, inequity, disunity, and so on and so forth that could get everybody depressed and riled up if we let it. But the point is, that's real. That's the frustrating part that all of us are dealing with and navigating every day. And we look for where we can make a difference and where we can find the loophole, find the pathway forward. But what we have actually needs to be rebuilt and, needs to be started all over again. But having said all that, even if Black women feel that, hey, this system isn't for me or what have you, it's important for her to know that she's not alone. There are other women on the journey who are ahead of her, right beside her, coming up behind her. So together, there's some collective support and wisdom for, hey, you can make it. You can make it through. You can navigate through. And sometimes we can become so overwhelmed with all that's bad about everything, that we become paralyzed or just a sense of defeated. But it might just taking a pause and asking for help, finding, well, who can I turn to? Where can I turn to? Because I feel stuck right now. I feel so frustrated right now. And just finding a point or someone to ask, or finding a resource for wherever you are on the step or the phase of the journey to navigating care, finding sisters, finding a network, finding allies, culturally specific places and groups to be in community with, whether that's a support group, a women's group, whether that's attending a single event like a conference or a class or a walking group. This podcast is another example of a place to sort of find community and find potential resources and people to navigate. So I think it's important that when we look at that there are many things against us, there are also many people and resources that can help get us through.
Beautiful. Thank you so much for that. The Love Letters to Our Bodies podcast is sponsored by Moyo Institute Incorporated, a nonprofit organization offering heart-centered educational experiences, and the Lloyd Symington Foundation, which supports visionary grassroots cancer programs. Marion, when you think about the women in Northern California's Black church communities, what are the barriers to care that you see most often, and how does health ministry try to meet those?
I think Michelle really brought it forward about our broken system, which is definitely our barrier. I am so confident in the relationship that I have and the churches that I know and work with in Northern California with the University of San Francisco. I feel that we are, well, am I supposed to say blessed? I think that we are so blessed and fortunate to be able to partner with UCSF and the agencies that they bring on board to broaden our understanding in our churches. I'm very confident in things that I bring forward to the faith-based communities. Oh boy, I'm a nurse. They're evidence-based. They have been shown to work. They're not requiring people to deny their culture, to walk away from tradition. There is this speak your truth, but be knowledgeable about what that truth is. And I just feel that we're so strengthened to actually have a partnership with the university, with the Cancer Society, with the public health departments, the diabetes, and so all of these areas where we bring to people, what does the science say? And then the people, the community brings to us, this is what it looks like in our world. This is how it's impacting me day to day. 30 years ago, we did talk about no chicken, no fried chicken. Okay, so now we can look at moderation. A chicken wing will not kill you. A chicken wing every day
Will.
might be part of your problem. Carbs are bad. Well, you need moderation. We need my personal favorite. I remarried in my older years, and my husband was a soda fanatic. And when I went to his apartment, his pantry had every 2-liter flavor imaginable because he liked to mix them all up together. And I was like, no, dude, no, no. And we were able to get a compromise going. And within the first year of our marriage, he lost 20 pounds because he cut his soda consumption because that just was not filling my pantry. I was filling my pantry with vegetables and and just that little change. It didn't say to him, "You will never be able to drink a soda again because you're marrying me." It came down to let us reason together. There needs to be some compromise. And we did that same compromise in my church. We had soda machines to raise funds for the kids. And our ministry said, do we really want to risk our children's health by teaching them that the go-to drink is the popular soda of the day. And we're going to raise money to take them to the park on their soda consumption. We have to find another way to do this, to protect them, to educate their minds on what's good for them, but to still encourage them to do this fundraising thing together as a community so that they can enjoy what was it, Great America or whatever. There's a way to do it and not abandon your principles and take care of your health.
Thank you for saying that. It actually reminded me of a scripture, which I can't quote properly, but it's something about what comes out of your mouth. Do you know the scripture I'm trying to get to? Like, it's more important
Are you
what
talking
comes
about
out of your mouth.
the power of life and death is in the tongue?
Maybe so.
Yeah,
Maybe
as
it's
you
that
speak
one.
it.
You know,
Michelle, do you know
what
the
goes in your
reference?
mouth, but what comes out is more powerful than what goes in,
Oh,
something like
that was
that.
when
That was
I think it was Paul, and he dreamed and he saw the food coming down and it was swine. And he says, "Oh no, I've never defiled myself with this." And the Spirit spoke to him and said, "Nothing that God has made will defile you. It is what comes out of you that is defile you." And it's Peter, slay and eat
Mhm.
was the change in the scripture. So
Well, I appreciate your saying that because I tend to be a little bit on the extreme vegetarian, be a vegetarian. Don't. So it's actually good for me to hear about how important it is to, one, honor the culture and to really seek compromise in terms of helping people to have healthier habits. It's more like that. You get more honey, you get more, I can't think of these little phrases
you get more
today.
bees with honey.
Bees with honey
No.
than with
Well,
vinegar.
you don't have to.
So,
You can't kill it. You can't eat the what is it? Eat the elephant all whole. You got to
oh,
take a bite at a
One bite
time.
at a time.
Yeah,
Yes,
one
yes.
bite at a. And when I was young, I was a crazy person. I was like, y'all just got to stop this, and that didn't go over well. And I
right.
talk about working in churches when you were talking about this healing and wholeness. Leadership, your clergy, the unofficial leaders have to be on board with whatever type of change that you're talking about. You just can't walk in there and say, okay, I'm the health department, I'm the nurse, we're the university, and this needs to change. That's not what's going to happen. It's their home, their house. When you come to my house, my relatives love that. But when you come to my house, there's a standard in my house. You can
Hmm.
offer some options and you can tell me, Auntie Marion, I'm a strict vegetarian and I just can't eat such and such. And I'm going to be a gracious enough host to accommodate you. But I'm not going to change my whole menu.
Exactly. Exactly. I
And
get
that's
it.
kind of how it is in our churches.
Exactly.
We're the guests, those of us that are coming from the outside in saying, these are the best things for you.
Hmm. Beautiful. Thank you so much. So, Michelle, this podcast is called Love Letters to Our Bodies. The whole premise is that our relationship with our own bodies matters, that the body holds our stories and deserves tending. When you hear that, what lands for you?
I think what you summed up is certainly really lands for me a point of reflection to really pause and reflect on what do I value in terms of my body and what is the vision I have for what I want it to represent or what I want it to look like. So the first thing that lands is just kind of a time of introspect, thinking about it, and then being able to eventually sort of articulate as it relates to values and vision and what I would like it to look. I think maybe a summary statement would be to just remember that I'm trusted to be a good and faithful steward with this body that I've been given for a time to take care of and to do that to the best possible that, would bring glory to God's name.
Beautiful. Thank you. Thank you. So, Marion, as a nurse and a faith community health director, how do you hold the clinical knowledge and the spiritual knowing together? I mean, you talked about this a bit earlier, but when you're sitting with someone who's sick, How do you hold those two things?
I believe that the most important thing is to honor the person, meet them where they are. Not my journey, it's theirs. I find myself a lot of times, I would say with the person, can I pray with you? And they would say, yes. And I would say, will you pray? Your voice and your prayer is much more important than my voice in your prayer. This is your work. This is your life. And I'm a come alongside. What are you looking forward to? Who are you praying to? And what are you asking for? And how can I support you in that ask and not tell you what you should want your outcome to be? It's your journey. I'm just a co laborer in this with you. I have some information, but I am faith based. I know God's got all the information. I just see this little
Beautiful.
speck.
hmm Beautiful, beautiful. Thank you for that. Thank you for that. And you're right on target. It's so important for that person to be making the connection and to be relying on their own understanding as it relates to their relationship with the divine. So that's really quite beautiful. So, Michelle, where can people find UCSF's community cancer education resources and what should they ask for? And actually, I don't think we said the actual name of the faith-based partnership. So I wanted to make sure we get that on audio as well.
Okay, let me give the whole official name of everything. So one is we are with the University of California, San Francisco, Helen Diller Family Comprehensive Cancer Center, Office of Community Engagement. And we have a community advisory board with our Faith and Health Communities Committee that Marion co-chairs is a part of that community advisory board. And then the Faith and Health Communities Committee has a network or a signature project that goes by the name Abundant Life Health Ministries. And we're looking to have those who partner be able to have a rich, full, abundant life, healthy mind, body, and spirit, soul. So get that out of the way. But we'll just, like I said, we'll just refer to ourselves as UCSF and then just sort of go to keep it short because we have a lot of different components. And if no one can remember anything else, if you can remember those four letters, UCSF. And anyway, a way to get a hold of us to learn more or to engage with us further, either through our Faith and Health Communities initiative or our other initiatives, you can start with our website, cancer.ucsf.edu, and then select community engagement. And that will bring you to our office page, our site. It will also bring you to our email address and things of that nature to reach out to us to gather more information, to be added to our listserv, to get invited to meetings or events or things that we're doing on a regular basis, on a monthly basis, whether that's our cancer campaigns or our quarterly chat and chew public forums or our annual events. So I would say starting there with cancer.ucsf.edu will open the door to being able to access our other information and resources.
Beautiful, beautiful. And Marion, for a church that wants to take its health ministry more seriously, whether it's one nurse or a whole committee, where do you start?
Well, you certainly can go to that UCSF website and you'd be able to find me there and find our committee there, and we can help you with the infrastructure for that. We have trainings, Health Ministry 101, and we're more than happy to connect with a faith community and help them look at where they are, because sometimes you have more in place than you even know. Look at where they are and help them in building that infrastructure for a health ministry program.
Beautiful. Thank you so much. Now, this last question is for both of you. If you were writing a love letter to your own body today, what's one thing you'd say? Michelle, we'll start with you.
Yes, I did want to just also mention one more thing related to what Marion said, because on September 11th, we have our Faith and Health Communities Committee, Abundant Life Health Ministries gathering for faith, health, and community. And we'd certainly love any of the listeners who are interested to join us on Zoom for that. That's September 11th from 12 to 2. So please check out our website to contact us so we can make sure we get you the registration link and information for that. Now, back to your question regarding a love letter. I think it's a way, again, I'm one of those people that I have to kind of go inside myself and think and ponder and sort of reflect before I can actually express something in writing or verbally or things of that nature. But I think I would see the letter as part of my legacy, something I not only want to communicate to myself now, but something I might want to share or leave behind for my loved ones to kind of pass on where I was at in that particular time or on that place on the journey. But I would say something about slowing down. That's something that I really know that I need to do more of. It's slowing down and pausing and not having such a go, frantic pace of life. And then pausing to take time to show and express gratitude and appreciation. Sometimes moving so fast, you can miss just the small things, the blessings, the small things that might be taken for granted. So I think taking the time to be able to write a letter gives you some time to pause and reflect on some things I want to be thankful for. Again, people or things that I would value or what I can think of for right now without spending the time of going deeper.
You have to promise me that you'll write that letter. So, Marion, I'm going to ask you that same question. If you're writing a love letter to your own body today, what's one thing you'd say?
I have the advantage of coming second, so I get to think about that. And I was thinking about that song about wanting to live the life I sing about. That's really what my letter would need to consist of. If I could just live the life that I tell everybody else will give them abundance and peace and joy, if I could model that for me, oh gosh, I'd be a for real superstar. I'm an outgiver, not an in pourer. So if I could pour that into myself, live that life that I talk about, I'd be in a really great place, mind, body, and spirit.
So we're going to take that as a challenge to you. you know, and I can say that both of you are superstars already. And it's so wonderful to connect with you both. And, we have these personalities where we are givers and that we care deeply about what's happening in the world and in our communities. And so it's natural to sometimes become a little bit overwhelmed with the giving and not taking enough time to receive. And so my encouragement to both of you and to myself is to slow down also and to take some time to receive the nurturing and the love and the support that's available for all of us. So thank you, Michelle, and thank you, Marion. It's been a true pleasure speaking with you today. I want to let our listeners know that on Friday, July 17th, at the Center for Healthy Communities in Oakland, we'll be having a Love Letters to Our Bodies Day of Renewal, where women who are navigating cancer, either as patients or thrivers, or caregivers, or even allies are welcome to come and take advantage of integrative health therapies that will be available there all day. So thank you, ladies, for joining me. And we'll make sure that your contact information is in the show notes so our listeners can reach out to you. And this will be on the air shortly. So it's a pleasure.
Thank you for the invitation.
Thank you again.
You're welcome. You're welcome. That's a wrap. Thank you so much for listening to Love Letters to Our Bodies, conversations on health, healing, and happiness. To find out more about the Love Letters to Our Bodies project, visit our website at moyoinstitute.org. That's MOYO Institute.org. Follow us on social media and subscribe to the podcast so you don't miss an episode. If there are topics you'd like for us to discuss, let us know. Remember, your body is beautiful, girlfriend. Love it.